And it looks like we are live. Yes, we are live right now on the WMAR2 News Facebook page this morning for another Facebook Live discussion with our friends at GBMC. Thanks so much for joining us. And I'm joined by Esther Kim, who is with the Vein Center at GBMC. We got an interesting topic to talk about this morning with Esther Kim. We're talking about potential for tattoo removal and also hair removal. Esther Kim, thanks so much for joining us.
Good morning. Thanks for having me.
So I got to get past this part. First of all, you're in from the Vein Center at GBMC. Our topic, though, is about tattoo and hair removal. So for those who don't know, that is something that can be offered at a facility like yours.
That's right.
Can you just talk a little more about that process?
Sure. For laser hair removal, we can treat anybody with any skin color. It usually does work best with people who have darker hair colors, but also your medium lights. And then tattoo removal, if you don't like it, we can help you get rid of it.
So we'll talk about them, I think, separately. First, on the topic of hair removal, sure. There's lots of ways to do it that women and men have been trying over the years, and different ways have different benefits and liabilities as well. What are some of the benefits to doing a laser hair removal in your facility?
I think the largest benefit would be that this is a permanent reduction, whereas if you were to shave or wax, your hair is going to come back. But with laser hair removal, any follicle that we get rid of, it's gone for good. It is not coming back. So really, once you've completed a series of the laser hair removal treatments, potentially you may not have to shave or wax ever again.
And, without getting too, particular, but what parts of the body are people typically coming in to have treated there?
I mean, we can do anywhere you want, honestly, from your toes to your legs, bikini area, underarms, facial areas. The only place I really don't want to do is your scalp. But any other area is, up in the air, you can do it.
And I'm curious, Esther, if people who come there have typically done other things previously. For example, maybe they have been shaving a certain area for many years, or they have done waxing for a while, and then eventually they come to the decision that, I think I'd rather just get this done once and for all.
Yeah, we have many patients that way that do that, especially because sometimes, shaving can be irritating as well as waxing, and you get the razor burn or you get ingrown hairs. And with the laser hair removal, you can potentially get rid of all of that, and you won't have to deal with it anymore.
So let's talk about the actual process. Are we talking about, for laser hair removal, something that might take several visits over a course of a period of time, or is it typically just one visit and you can be done?
So you're correct. It does take multiple sessions to really get rid of it. I like to say that we get rid of about 80 to 90% of the hair that we treat. Most people, it takes about an average of 8 sessions, and we do it about 6 weeks apart. Everyone's a little bit different, so I do try to cater their treatment to each individual person. But on average, I'd say 6 weeks apart, 8 treatments, and you should be good to not have any more treatments.
Wow. And this may be a really stupid question, and I apologize. Is it each individual hair that you have to go in and use a laser treatment on? And in that case, there's a lot of them, so it might take a long time to do it.
No, so the laser targets about a dime or nickel size area or surface area at a time. So it'll hit multiple follicles with one pulse. As an example, if we were going to do, say, underarms, on average, I'd say it requires about 100 pulses or so with our laser. And that really only takes like 5 minutes to do. So it's a quick treatment. You can come in, get it done. We target a lot of hairs with one pulse, and you can do it in between lunch hour if you wanted to.
That is absolutely fascinating. And the question is, so does that hurt? Some people might be a little put off or afraid maybe of coming in, for reasons of pain management.
I mean, it really just feels like a hot rubber band snapping on you. We have something called a Zimmer cooling system. It's basically very cold air that we blow onto your skin during the whole treatment process. And it helps you stay more comfortable, and it also helps to keep your skin safe during the treatment. And most people tolerate the treatment just fine, particularly people who have waxed before. I believe this is much more comfortable than that.
Right, because it's not like that's the most comfortable process in the world either.
Right.
So, right.
There's no
Everyone.
cooling system for waxing.
Now, is this something that after they're done with all the treatments, potentially people may have to come back at a later date? Like, is it permanent, or is that all they have to do once they're finished?
So it is a permanent reduction. Every now and then people will need a touch up. Sometimes hormonal changes such as like pregnancy or menopause or something, and people will need to maybe come back for a touch up or two. But other than that, it's really, that's it. Once you're done, you're done.
Wow. And is it any negative side effects that people have experienced, or do you kind of make sure people know about that before they do the treatment?
As long as you don't have sun exposure prior to your appointment, that's usually the main thing. There's really minimal side effects. Most people will be a little bit, a little red afterwards. That goes away within 20 minutes or so, if that. And you might have a little bit of irritation for less than 24 hours, but after that, you're okay.
Okay, and we were also talking to you today about the removal of tattoos. It seems like, I don't know if tattoos have gotten more popular over the years. I definitely think, and this is just from observation, it seems like more different types of people get tattoos now. It doesn't seem like it's any one type of person who winds up getting them. They're pretty much for everybody these days.
Right.
But at some point, there must be people who decide, you know what, I think I don't want this anymore for whatever reason. But in the past, I feel like they've been so difficult to remove that people avoid even trying. And I think you're going to say today that's not really the case anymore.
Yeah, it really isn't. I mean, if you don't want it, we can help you get rid of it. We can really treat on any skin color. In the past, I believe it was, more for patients who have fairer skin. But we certainly do treatments on people with the darkest of darkest, skin colors, and we're able to remove it safely. And they don't have to look at it anymore if they don't want to.
So as I understand it, getting the tattoo is a dye injected into the skin, but not all that deep, but it is still in there. So what's the process of getting rid of that?
So with tattoo application, it's an ink that gets set into your skin. And, naturally your body wants to get rid of that ink because it is far into your body. So, if you've had a tattoo for a number of years, most people will notice that it fades over time. On its own. What the laser does is that it breaks up those ink particles so that it's smaller so that your body can get rid of it faster. So that's what we do here. We target the ink, we break it up so that your body can do the work and get rid of it.
And so what about this process for a tattoo removal? Does that take several visits as well?
Correct. And it does, and it's very different for everyone as far as the number of treatments that you need, because everybody is different and every tattoo is different, and every tattoo artist is different. But usually most people need anywhere between 3 to 10 treatments to get rid of it.
If I can put you on the spot, just off the top of your head, can you think of potentially what was the largest tattoo or most complex tattoo that you've ever had to eliminate in your career of tattoo removal?
I don't know about the largest. We've had some pretty large tattoos. I think the ones that get a little bit more interesting are when people come in with their scalp tattoos, because we do worry about your scalp swelling, so we can usually only do a portion at a time to be safe. And then sometimes there's hair in the way, so that gets a little tricky. And when you put the laser on hair, it burns and it smells. So people do need to usually trim before we do something like that. But yeah, that's usually the more interesting ones because it is a little bit more tender to that area as well.
And so potentially, what does that feel like? I mean, is that also that the person might need to have sort of a burning sensation when they're getting that treatment, and even after as well?
Yes, so it's actually pretty similar to the hair removal, except it's probably just a tiny bit more like a hot grease kind of splashing on you. We certainly can prescribe numbing cream if you need it. And then we also use the Zimmer cooling system for that as well. The tingling kind of burning sensation is pretty much gone once the treatment is over. There might be some tenderness to touch for about 24 hours or so. But most people, again, can tolerate it just fine. It's a very short process. If you were to have, say, a tattoo that's, in 1 by 1 inch, it takes 5 seconds to treat that.
Wow. And then that starts the process of it being gone completely. And just to reiterate, for people who weren't aware that they could decide at some point to get rid of a tattoo, it is now in 2021 possible and accessible to do that.
Correct.
Yeah.
It definitely is.
And what about the treatment, say, after the procedure? For your even if it's been laser hair removal or if it's a tattoo removal, what are your recommendations as far as people's skin going forward? What should they do to keep that area healthy?
For both the tattoo removal as well as the hair removal, really it's just about keeping it clean, not going into unsanitary conditions. And those conditions I consider, pools, lakes, oceans, usually for about a week or so to be safe. And then also, I don't like it when people expose themselves to too much heat within the first 24 to 72 hours, just because the laser is hot and I don't want to trap any heat in your body. So usually I'll say avoid, running 10 miles after your treatment. Wait till, the next day at least.
Hmm.
But that's the post care. And again, sun exposure kind of during the whole treatment process, trying to avoid that. Because they will increase your risks for, some of the, obviously it's hot, it is a laser. So there is a risk for, burning and scarring. But if you avoid the sun, you really, those risks really go away.
And what are some of the considerations for people for laser hair removal and tattoo removal as far as deciding, you know what, I think this is what I need to do? When do they know this is the right treatment for them?
For hair, honestly, once you're tired of, repeatedly having to shave or wax, if you're getting skin irritation from it, that's about the time for you to come and get the laser hair removal. And the tattoo, honestly, I have people that are 18 years old that come in to, 65-year-old women who are like, I got this when I was 20 and I don't like it. And my kids look at it funny. That's probably when you should come in and get rid of it. And the sooner you start, the faster we can get rid of it, right?
Wow, that's really neat. And is there ever a situation that a patient might come in where their health insurance might cover tattoo or hair removal?
Unfortunately, it is cosmetic, both for the hair and the tattoo. So we've not really seen it covered. Although we do have patients, particularly for hair removal, that do have underlying medical conditions that, cause them to have more hair than your average, person might. And certainly they get treatments. And, sometimes those patients do need more maintenance treatments. But, they have very good results with it. So hopefully sometime in the future, insurance will help cover it.
Joined by Esther Kim from the Vein Center at GBMC, and we're talking about laser hair removal and laser tattoo removal as well. Got some viewers on the Facebook page asking questions, Esther. One of them is about the areas. Again, we talked a little bit earlier about areas that are potential for being treated for hair removal, and again, how long it takes to get that process done.
Again, we can treat, your underarms, your arms, your legs, your bikini, the hair on your fingers, the hair on your toes, your face. Each area, depending on, how large the area is, takes, a certain amount of time. Again, if we were to do underarms, really 5 minutes. something like your legs, if you're doing your entire legs, that might take, 40 minutes or so. Bikini area, typically 15 or 20 minutes, depending on the person. So it's, some of them are very quick and others do take a little bit more time depending on, how large the area is.
And for hair removal, do they have to come back over several visits again?
Correct. Usually on average, I'd say about 8 sessions will do the trick.
Mm-hmm. It's just incredible that it seems like, and you can correct me if I'm wrong, but it seems like the technology and the process has improved on both of these in recent times.
Correct. Yeah, their risks are so minimal now that, there's no reason not to do it if you want to get rid of your hair or your tattoo.
Right. Wow. Well, thanks for doing this. Esther Kim from the Vein Center at GBMC. And I got a question now again on the Facebook page before I let you go from Alicia, wondering what a typical treatment might cost, especially given, that it's at this point unlikely that their insurance would cover it. Can you just talk about some of the costs for the various treatments?
Sure. We actually have a pricing list. It's posted on our website. So you can certainly go there, but it ranges depending again on the body part and how small the area is. If you bundle your sessions, you do get a discount. But if we're just going per session, something like, your upper lip would cost $100 per session. But again, we have a list online that you can look up.
Okay, that's at gbmc.org/vein. Esther Kim from the Vein Center at GBMC. A fascinating discussion. I really appreciate you spending some time with us this morning.
Thanks for having me.
Okay, and thanks for watching our special Facebook Live discussion here on the WMAR2 News Facebook page. Have a great day.
Have a great day.